So let's clear up a common confusion. Prostatitis isn't always an infection. It's a term that can refer to different disease states, which makes it confusing. There are four types of prostatitis, and only two of the four types are really an infection in the classic sense. I'm Dr. Kent DeLay, a board certified urologist in South Carolina. So let's get into these types. Type 1 is acute bacterial prostatitis. You have sudden pain, fever, and difficulty urinating. You are sick. This is a true infection and needs broad spectrum antibiotics very quickly. Type 2 is chronic bacterial prostatitis. The symptoms come and go. You can sometimes culture bacteria, but not always. Sometimes a urine culture after a prostate massage can allow us to find bacteria that wouldn't normally show up in a culture otherwise. Treatment usually involves longer courses of antibiotics in the hope that you can eradicate the bacteria. Type 3 is different. This is chronic pelvic pain syndrome. It is the most common, and we call it CPPS. It's the most common type, and it is very important because it's not an infection. It's a pain and tension condition, and we'll talk more in a moment about how we can identify which symptoms are impacting quality of life most and address them. Type 4 is asymptomatic inflammatory prostatitis. You won't feel anything or have any symptoms. It's usually found during a prostate biopsy, and there, the pathologist will see more white blood cells than is normal, but once again, no treatment is indicated. So let's talk about the U point system for type 3 prostatitis. It helps us tailor treatment based on the actual symptom profile. And let's break down what each letter identifies as a symptom type for classification and treatment purposes. The first U are urinary symptoms, and these often respond to tamsulosin or other urinary medications. P, psychosocial, we might consider counseling or antidepressants. O is organ-specific pain, usually the prostate, and NSAIDs or sometimes a supplement called quercetin is used. I is infection, and this is when cultures are positive and antibiotics still matter. N is neurologic, and we will use medications like gabapentin or amitriptyline to lower nerve pain. And T is tenderness in the pelvic floor, and this is where PT or trigger point injections can be used. If you've been stuck on antibiotics many times and told you have prostatitis, it might be helpful to find a urologist who understands that multiple lines of therapy are often needed to get most patients better,